सरगती होता है।
हाँ
तो होती है ना, एक होता है काला और सफेद सा। मीठा जो होता है वो जो सफेद होता है।
गर्मी के टाइम आते हैं।
हाँ तो भाई
आगे
है।
काले 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 गाड़ी तुमने
आप यहाँ जाओगे ना केंद्रीय भंडार के पास, केंद्रीय भंडार के पास 4 पेड़ खड़े थे। फिर अंदर को मुड़ जाओगे इसमें केंद्रीय भंडार, अच्छे लगते हैं। गाँव में हम पत्ती की छाती, पत्ती और ऐसे ऐसे हिलाते पेड़।
मीठे होते हैं, अच्छे लगते हैं, मीठे होते हैं
या तो बीते गाँव में तो ऐसे ही पियाते हैं।
और ताकतवर भी है वो, ताकत होती है। सैसूट में रोज खाओ ऐसे कितना बनाओ।
लाइब्रेरी में ये सुनते हैं, तो जब चल जाएंगे तो जल्दी चिड़िया खा गई।
गाँव में बहुत है।
गाँव में जितना चिड़िया यहाँ पे अच्छा ठीक है, गाँव में खेती और यहाँ तो हम लोग आएंगे, अंदर वाले तो आने बहुत कम आएंगे, आएंगे तो हमें पेट में ये भी है यहाँ। आम का भी करें। आम
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 आम भी
आम का पेड़ है यहाँ भी है।
बहुत है। उधर भी है, शाम को चढ़ाई पे सीधी जाना है।
हाँ इसमें सामने
हाँ बिल्कुल सीधे ऊपर चढ़ाई पे अमरूद भी है।
अमरूद का भी है, पर अमरूद का इधर नहीं है। चांसलर लॉज के नीचे होना है अमरूद के पेड़।
क्या खाए कैसे?
वहाँ वहाँ लोग रह रहे हैं ना,
ये तो सब तुम्हारे समझ में
वहाँ पर क्वार्टर है तो वो क्वार्टर के आगे है।
हाँ वो अमरूद का पेड़ है।
अमरूद के पेड़
यहाँ भी है। केंद्रीय भंडार से ऐसे मुड़ोगे ना साइड में,
हाँ
बिल्कुल सीधे चलो लास्ट में अमरूद के पेड़ है।
तोड़ने नहीं देते,
नहीं नहीं
पत्ते नहीं तोड़ने देते।
नहीं,
कहानी सुनाता है
वो अमरूद बढ़िया
हैं?
बहुत बढ़िया करते हैं।
ये अमरूद खाते नहीं है ना।
वो खाते नहीं अतुल सहूल सतूत नहीं खाते।
क्या खाते?
सतूत
सचुत खाते।
इसलिए कर रहा है दाल है नहीं।
तो सतूत खाते।
ये बाबा रामदेव का बहुत
अमरूद जो है ठंडी के टाइम में आते हैं अच्छे।
नहीं बहुत अच्छा है, क्योंकि अमरूद महंगा है
और खाने में
भाई। अमरूद है ना, इसमें कीड़े होना वैसे जो उस बरसात में जो चलता मारेगा उनको, कीड़े होते हैं बरसात में। ठीक होता है बारिश में, वो जो अमरूद होती है ठंड की मीठी होती है, तो ठंड के
कैरेट मिलते हैं वहाँ पे।
मैं तो खैर अपने लोग मंडी में
या
कोई जाता खरीद के खरीद लाता।
एक दो से दो लेना पैसे ले जाओ ना।
भाई बहुत अच्छे कबूतर में यार।
ये पैसे ले दो।
नहीं मैं ले आऊँ।
वो जो लेके आते हैं बड़े
वो तो कह रहे थे ना मेरा नेक्स्ट टाइम तो इसमें वो पूरा गोदाम खोला थी मैंने तो 40 पर रेडी लगा रखी है। उसने वो उसको रेडियो को दे रखे कि मेरा 50 रुपए किलो बेच है और उसको 10,000 जो उनके जो ऊपर का बेचेगा 50 से, तो आपको खरीद लाना है।
कौन बजाना है क्या हो अच्छा कर रहे हो देखो यार मैं
चले
ये पेपर आ जाते
पता चलो ना इस बगल के
तो यार वो फिर कुछ आने यार खराब हो गया यार रुक गया था ले खा पे
चलो
बुका
क्या
वो वही छोड़े
दूसरे में लिख के दे दो ना।
वो कहाँ से ली गई वो तो ले दे देंगे चलो
यार नहीं जेब में तक है नहीं
तो हाँ कहाँ ले कौन ले गया पता नहीं
यार उसको लेके कौन जाएगा। पर यार पता नहीं
तो भूल गए उसको कहीं तो उसको कहीं भूल गया
ना।
फिर जीती
अच्छा आज जाऊंगा मैं स्टोर में जाऊंगा।
जीत ने वो लेके आना है फिर
क्या
स्टोर से
क्या चीज
सामान
देंगे नहीं वो?
तो
कैसे दे देंगे?
जल्दी चले जाएगा वो उसको चले जाना किसी के साथ तो जल्दी आ जाना
अरे मैं ये नहीं कह रहा हूँ, मैंने कि देगा नहीं बिना लिखे हुए।
लिख के ले जाना किसी के साथ चल जाना जल्दी आ जाना
अच्छा लिखवा दो।
सादा लिखते और सादा लिखते हैं उसमें लिखते भी
ये करो वाली है।
फ्लेवर फ्लेवर है फ्लेवर गड़बड़ है यहीं तो रहती है फ्लेवर गड़वाली होते हैं
अलीगढ़ में एक ऐसी जगह है जहाँ की लस्सी बहुत फेमस
हाँ
है। ऊपर कोलकाता।
हमारे में यहाँ तो मूंगफली होती है
उस समय 10 रुपए की लस्सी थी, अब तो 20-25 की हो गई होगी।
25 के जमाने की 50 रुपए की
20-25 हो गई
50 की बात है
लस्सी।
25 30
एक वो ऐसा बड़ा गिलास।
शाहिद भाई इतना बड़ा किलो इतने 80 रुपए में मिलता था अब सब 20 साल
हाँ,
में अब थोड़े मिलेगा अब तो तुम फुटकाट में नहीं पियोगे ना तो 20 से कम वो भी नहीं देता और ये बता रहे हो जो इतनी पुरानी दुकान बता रहे अब उसका रेट होगा 80 रुपए का मिला हम अपने आप पीते हैं गाँव में जाके ना 50 रुपए से चलने गए थे
और दही के ऊपर जो मलाई सी होती है ना, वो निकाल के इसमें डालते हैं, बहुत अच्छी
यहाँ
लगती
से दिल्ली में जो रेडियो पे लगाते हैं क्या करते रूह अफ़ज़ा डालते थे ऊपर से
आग को
अच्छा नहीं
जब
होता
डालते
लस्सी उसमें डालते हैं मेवा अच्छी होती है ऐसा बढ़िया बनेगा
हैं। लोग कलाकार नहीं है, उन्होंने हमारे से अच्छी लगेगी तो लोग ज्यादा खरीदेंगे।
हाँ में चला गया नाथू सूस वो बोला सीला चौक नाथू एक दोस्त आया ना तो लस्सी पीते अब भाई 150 रुपये लस्सी एक लस्सी 150 नदियों के ना बहुत जमाने की बात कर रहे हैं याद नहीं अलीगढ़ पता है कितना महंगा यूपी में अलीगढ़ से अच्छा नहीं है और वो भी ऐसे थी इससे अच्छा तो बाहर 20 रुपए किलो बहुत बड़े लोगों के हिसाब से ठीक होगी ना वो बस हम जैसे हम तुम के ब्रांड चाहिए ब्रांड हाँ तो हम तुम जैसे किराया दे दोगे हमें चाहिए वो एकदम बढ़िया मीठी मलाई डाल के बड़े लोगों को तो पानी की चाय मिलेगी ना होटल में तो उनको पसंद आएगी तुम प्योर दूध दे दोगे नहीं पिएगा बड़े लोग दूध ओके बिल्कुल जिसमें मैं तो ना अभी इनकी फराज की कंपनी तो वो कभी चाय के लिए बुला रहे थे कहते थे अभी कचरी चाय बनाना 2 बूंद दूध तो उसको बस जब बनने को लगा ना बस कुछ नहीं एक खद की भी नहीं लगानी है बस छान दो बीच में बस हल्का सा वैसे छीन बीन हो जाए छान लो तो उसमें भी 2 बूंद दूध रहता है तुमने ज्यादा दूध डाल दिया 50 स्टाफ में भी लगा लो आधे किलो दूध चलाकर पकाने के बाद कितना होता है
चलो तुमको क्या चाहिए?
और फाइल लेकर
नहीं तो मना भी नहीं कर। हाँ, तुमको मत दे देना। सर नमस्कार।
हेलो।
हाँ मैम।
आ रही है आवाज?
हाँ मैम, यूट्यूब भी चेक कर लीजिएगा, वो भी लाइव कर दिए।
अच्छा।
हाँ अब पोस्टर बढ़िया आ रहा।
हाँ उल्टा
उल्टा आ रहा है लेकिन
पंडित जी
पोस्टर।
बताइए कैसे
नहीं
करें?
मैम, आपको दिख रहा होगा उल्टा, हम लोग को सही दिख रहा है।
अच्छा अच्छा, फिर ठीक है। हम यही सोच रहे थे कि क्या मसला है, उल्टा दिख रहा है।
नहीं 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 नहीं, वो वहाँ पे आपको दिखेगा उल्टा, लेकिन यहाँ पे सही दिखेगा।
अच्छा
अगर आपको वहाँ सही दिखेगा तो इधर उल्टा दिखेगा।
अच्छा,
नहीं नहीं थोड़ा
ठीक है ठीक है। अच्छा ठीक है। हम यही सोच रहे थे कि क्या मसला है।
कीमती जेवरा।
ए मोनू, अरे बेटा ये जरा मिश्रा जी के वहां देखिए। नहीं।
मेरी हवेली में खुश रहने का वाहिद तरीका जबान को तालु खान के कवानीन और खंजर चाहता है जैसे तुम चाहते हो। मैं ये चाहता हूँ कि मैदान जंग में तुम्हारे साथ एक मर्द की तरह लड़ूं, लेकिन किया तो ऐसा नहीं है। उसने हमारे साथ खेल खेला। मैं समझता था कि आलिशान मेरा कुत्ता है, लेकिन वो देहातों का जासूस निकला। क्या मतलब है इस बात का कि हाथों ने फिर से अपना संजाक सरदार आलिशान को बना दिया। आज रात सोगोट पर एक भारी भरकम लश्कर पहुंचेगा। वो सिर्फ एक चीज चाहता है जो मैं चाहता हूँ। चंगेज खान के कवानीन रुको उस्मान, गुस्सा ना करो तुम। अभी मेरी बात पूरी नहीं हुई। तुम्हें पता है कि तुमदार साहब इस वक्त कहाँ है? आलिशान के साथ।
देखा नहीं था अभी ऐसे हर जवाब देने से पहले अपनी बहन और माँ के जानिब देख रहे थे। उनके घर के दामाद बेटा नासिर ना बहुत सीधा साधा और सोचा हुआ रहता है। अब तो मैं
अरे पुराने हेयर स्टाइल से अच्छे तो हमारे बच्चे
बिस्मिल्लाहिर्रहमानिर्रहीम।
सिर्फ एक माइक ऑन रखिए, बाकी सब बोलो।
एक माइक ऑन ऑफ कर दीजिए मैम। आप वहाँ पे 2 लॉगिन है। मोबाइल पे अगर लॉग है तो खत्म
किसके लोग हैं?
मोबाइल पे मत कीजिए।
हेलो हेलो, अस्सलाम वालेकुम। तो ठीक है ना बस। हाँ, औज़ुबिल्लाहि मिनश शैतानिर बिस्मिल्लाहिर्रहमानिर्रहीम। Assalamu alaikum to all of you. I welcome you all to the international webinar on evaluation of temperament in clinical practice under the patronage of our Chancellor Janab Hamad Ahmed Sahab and Vice Chancellor Professor Dr. Muhammad Afshar Alam Sahab, and under the guidance of our Dean Professor S.M. Arijati Sahab. As per tradition, let's begin the event with the recitation of Holy Quran. So I request Mr. Samir Hussain kindly come and recite.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ويل لكل همزة لمزة الذي جمع مالا وعدده يحسب أن ماله أخلده كلا لينبذن في الهتمة وما أدراك ما الهتمة نار الله الموقدة التي تطلع على الأفئدة إنها عليهم مؤصدة في عمد ممددة صدق الله العظيم.
Shukriya, Samir sir. As we know, our speaker, Dr. Murtaza Mujahidi, has joined us. So, I request Dr. Minhaj Ahmed for welcome address for this program.
Respected Dean, Professor S.M. Arijati Sahab, heads of the department, faculty members, dear colleagues, dear students, and delegates from different faculties, online participants. A very good afternoon. Assalamu alaikum wa rahmatullahi wa barakatuh. This gives me immense pleasure to welcome you all in this guest lecture series organized by two departments, Department of Surgery and Department of Eye and ENT. The School of Unani Medical Education and Research is a center like Mecca for Unani learners, not from India, but also from the globe, to make the learning and sharing of knowledge here more meaningful, to make the learning and sharing of knowledge more meaningful, we are bound to broaden our sphere of knowledge here beyond boundaries. New education policy, MOOCs, SWAYAM, and credit-based knowledge credited demands. Therefore, all these activities in absolutely changing scenario of education. Therefore, this international webinar is being organized by the two departments of SUMER with commitment to continue such deliberations in future. Theory of Mizaj, its assessment and its uniqueness is unique and plays an important role in clinical practices. In this webinar, we are having Dr. Murtaza Mujahidi from Iranian Republic of Iran, who is a true learner, true researcher, and keen learner of Greco-Persian medicine. His scholarly deliberation will surely not only enlighten us, but also open new avenues for collaborative research between India and Iran. Once again, I welcome you all and thanks for making this event successful one. Thank you. Shukriya.
Thank you very much, Dr. Minaj. As we know, misaj or temperament is one of the basic concepts of Unani system of medicine, upon which diagnosis and line of treatment of the disease are based. Any deviation from normal temperament results into disease. It is very important to keep individual's temperament in mind while diagnosing a disease. The management of disease depends upon the correction of alternated temperament by using various regimes and drugs. After evaluating the temperament of the patient, the drugs are selected accordingly. The concept of temperament is fundamental for the understanding of the drug actions and disease process also. So it is a very important topic for practitioners for a better diagnosis and for a better treatment. Now, I would like to, I request to Dr. Arif Zaidi sir to please join.
Thank you very much. Am I audible to you?
Yes.
Yes, yes.
Thank you very much, Dr. Zahra. Let me thanks to Dr. Murtaza, first of all, who have chosen such an important topic, misaj, temperament, which is one of the, you see, fundamental of Unani system of medicine. Because in today's life, we talk about temperament, but in general life also, in practical life, while treating a patient. And since the system of Unani system of medicine is based upon temperament, and even the medicines also have their own temperament, and you know that treatment is temperamental, anti-temperamental, so that to come over the conclusion that which particular person having what type of temperament is an important issue, is an important talk. And you see that several peoples are discussing and trying to do something through a various mode, through a various, you see, format, by taking the history of the patient to come over that which type of temperament the particular person is having, and accordingly the decision to provide medication for that particular treatment. So that this has become an, you see, very important issue. And to my mind, it is my individual opinion, it is debatable under, you see, it is under debatable among various peoples, because how to decide and what are the things, though several thing has been laid down in the literature that what we have to look for. But even though so that what I was saying, that Dr. Murtaza is with us, and he's working over it since a long time, and he's the better person to elaborate over this topic. And I thank Dr. Murtaza for accepting our request to speak a topic. And over to the Dr. Zahra. Thank you very much.
Thank you so much, sir. Now I request Dr. Murtaza Mujahidi. Sir, are you audible?
Yeah. Yes.
Thank you, sir. Dr. Murtaza Mujahidi with us today. He is Dean and Head Traditional Medicine and History of Medical Science Research Center, Health Research Institute of Babul University of Medical Science. He is also Head Department of History of Medicine, School of Persian Medicine, University of Medical Science, Babul University. He is also Head Department of Persian Medicine, School of Persian Medicine, Babul University of Medical Science, Babul, Iran. He has completed his PhD from Shahid Beheshti University, Tehran, and he has been honored, many honored. In 2016, he was honored Persian Medicine Researcher, top Persian Medicine Researcher from the Traditional Medicine Office of Ministry of Health, Tehran. Top Professor for the Babul University of Medical Science in 2018. He has guided 20 PhD theses and he has written 4 books. And he's constantly working on Mizaj. I think all of us have associated with his group, which he is running from a long time. And he's visited our university and our faculty also 2 years back. I request Dr. Mujahidi to please give this lecture.
Assalamu alaikum wa rahmatullah, all the participants, and thank you for your invitation for this webinar. If you let me, I share my presentation and start the presentation. At first, I thanks all people that arranged this webinar, and I remember my visits from Jamia Hamdard and your school in Yunan Medicine School in the I think in 1989, and I learned more from you in your university. Just because the subject of this webinar is about the Mizaj, I selected some important challenges about the Mizaj research, and I would like to we discuss about this challenge. At first, let me to mention to and to most people, famous people that revital in the Unani and Persian medicine in these 2 countries, India and Iran. The first is Hakim Ajmal Khan, and the second is Dr. Muhammad Mehdi Esbani, my great master from Iran, peace be upon him. And my topic of my presentation is the concept of Mizaj in Persian Unani medicine. challenge and opportunities. At first, I have a brief introduction of Persian medicine. According to the historical texts, Yunani medicine flourished in the ancient Persian civilization using the power of Persian scientists and the experience of Indian medicine and other medical schools. Persian has been the cradle of promoting this school for centuries. Many of these authentic texts are in Arabic or Persian, which have been written by Iranian physicians residing in Iran or India. Therefore, the school is called Persian medicine in Iran. But in India, with valuable scientific exchanges between Iran and India, both countries have long benefits from each other medical schools, and Persian medicine has been promoted through the use of the experience of master Indian physicians. With the advent of Islam and in the India subcontinent, the school in India flourished more to the extent that it served the health of the people along with other traditional Indian medicine. The school, with the wisdom of Indian scholars, for some reason named Yunani medicine in India. According to the theory of Mizaj, Persian and Yunani medicine adjusts the management of diagnosis and treatment based on field noun groups while considering individual differences. By the scientific approach of Mizaj ability in distinguishing individuals to defined groups in a community, Mizaj-based personalized medicine model can be introduced to the Medical Science Research Center. But for this aim and for this target, of course, we need evidence, and we need Yunani and Persian medicine evidence-based medicine, yeah? And the concept of the Mizaj, if the important base, important axis of these documents, as all of you know, because the participants of this webinar, most of them are professors and students of Yunani and Persian medicine. I have a short explanation about the division of Mizaj, because I think all of you know the theory of Mizaj and kinds and the basis of the Mizaj and other things. Just now, I would like to mention the challenges of the studies and research in the field of Mizaj as a basic concept of Yunani and Persian medicine, and what we will do for the future. Yeah, but now just I mentioned short to the kinds of Mizaj. As you know, we have two dimensions of Mizaj: hotness and coldness axis and wetness and dryness axis. And by combination of these three kinds of two aspects, we have 9 groups of Mizaj in the between peoples, all peoples divided to 9 groups in the world. As you know, we have on temperate, yeah, and for single group, as we mufrad Mizaj, wet, cold, hot, and dry, and for combined group, hot and wet, cold and wet, hot and dry, and cold and dry. Sometimes we say too hot and wet people we say to them sanguine mizaj, damavi mizaj, but there aren't. This isn't correct because the damawi and the dominance of sanguine is in the division of sick people, ill people, distemperament people. Yeah. In the kinds of the sue mizaj or distemperament division, we have eight eight group of people. As you know, without substance hot and cold, and with substance hot and wet, and with substance hot and wet, that we say name them sanguine. And other kinds of mizaj, as you know, without substance, as we said, sazaj, su mizaj sazade. Without substance, this temperament, we have four kind of them, and with substance that we tell to them sanguine, phlegmatic, chloric, and melancholic.
Hello. Sir, sorry, just a minute. Are you sharing your slides also?
Yeah.
No, it is not visible.
My colleague said it is visible for them. It isn't visible for you?
No, it is not visible.
Ma'am, it is
Please
visible.
disconnect and then
Visible.
again try the system.
We can see the slides. Sir, you can carry on. We can see your slides.
Okay, sir. Continue.
Okay, it is
Now,
visible? Yeah. For development, yeah. Please turn off your microphone and speakers. Maybe one person use two devices. Okay. As we tell in the beginning of my presentation, all researchers from some countries, especially Iranian and Indian researchers, are trying to establish the concept of mizaj by their research and by their published articles. In recent decades, this school has received special attention for scientific medical centers around the world, especially in Iran and India. In this field, researchers seek to find the origin of the mizaj and define it from a modern medical perspective. In this regard, the study of the correlation between mizaj and biological indices or various diseases has been considered. It is the opportunity, and for this purpose, the participants are divided into various mizaj groups. The problem starts from here. Why? Because we don't use a unique division as our books. They division in our books, textbooks are they divided people, health people, divided them to 9 groups, and their differences in various aspects of indices are assessed. In the new research, in the published article research, we don't have a unique division. Some researchers divided people to 4 humor dominance people, and as you know, each healthy participant maybe have temperate mizaj, no dominance of them or balgam or choleric or melancholic, and and we don't have any temperate division in this kind of studies. Conducting studies in the field of mizaj to prove the nature of this concept and the ability of Persian Unani medicine to divide individuals based on mizaj model is a very valuable opportunity to present the school of Persian and Indian and Unani medicine as a holistic medicine school in the world. There are important considerations in this regard that, if not observed, the contradictory results of this type of studies will be challenged. Scientific documentation of Persian and Unani medicine. As I'm afraid of this challenge, and I am very worried about this. As a specialist that worked on mizaj more than 10 years. The most important of this challenge is published article are: one, variety in temperament or mizaj groups divisions. It is the most important challenge. And we had to solve it. We had to have a unique division of mizaj groups in healthy person and in the patients as mizaj, for example. Variety in mizaj determination methods. Some articles they wrote that we identified the mizaj of participant by a standard method, but we don't have any method in their articles. Sometimes they use one specialist for determination of mizaj of participants. How about this specialist? This specialist is reliable, is valid, his identification of mizaj is valid? We don't know. We don't know any standard data from this specialist that they made some articles use for their surveys. Lack of a standard tool or scale or questionnaire or device in determining of mizaj in the published article. Of course, in Iran, because we developed and published some standard questionnaires for mizaj identification, most our colleagues in Iranian universities are using the standards tools in recent years, and they are publishing their articles, and we are trying to develop more and more standard tools for mizaj am, whole body mizaj for all kinds of people, mizaj a'za, organ mizaj. For example, we developed a standard liver mizaj questionnaires, stomach mizaj questionnaires, brain mizaj questionnaires, and we will present this kind of standard tools to the scientific centers, and they are using these kinds of tools for in their research, and will publish their results inshallah in the next future. Another problem and another challenge is no attention to temperate mizaj people in the most studies, as we mentioned, and it's very important. In most of biological indices, in the most of biological indices, we have a temperate index, and a little people are have less index, and a little people have more than temperate. For example, in FPS, for example, for tallness, for weight, and for other things. And as Hakim Sheikh Rais Bu Ali Sina emphasized in his textbook of Canon of Medicine, um, uh, uh, more people of the social people are temperate now, more than more warmness or coldness. No, most of them are temperate. And I read the most articles published in some countries. They divided all participants, healthy participants, in four humoral dominance: Damavi, Balgami, Safrawi, Saudawi. Where are temperate people in this studies? Insufficient sample size of volunteers. Most studies and surveys of the related articles don't have enough sample size. Sometimes they correlate, they assess the correlation between mizaj and one disease by 2 or 3 sample of, for example, Damavi mizaj people. And I think the results aren't valid. Lack of cooperation of methodological consultants and vital statistics in the studies, especially the India. When I visit my colleague and some centers in India, I couldn't visit any methodologists or statistics that work in the schools and centers of Unani medicine in India. In Iran, we are lack of cooperation of them, but I try to gather some of these people and these specialists in the methodologists and statistics man. And just now we arranged some workshops for them, and we each survey I begin and I start one people of one colleague and of the research is methodologists or statistics man. And we, as you see in my articles, each article that I published, we have one or more than one methodologists or statistics man in the team. Another challenge is lack of accurate data analysis for assessment, the correlation between mizaj and people, between mizaj and disease, between mizaj and paraclinic indices and other things. And each cross-sectional studies, we need to use a standard analysis method and data analysis. But I saw that in most of articles published there wasn't any data analysis method, and they, for example, they assess, for example, the percent of the groups by them, and the final analysis is cooperation between and assessment between the person of the groups. It isn't enough. Exactly, it's not enough. To solve this problem and draw a map of the Persian Unani medicine development community, a team of experienced specialists from different countries, especially Iran and India, should lead the study of temperament, mizaj research. As one basis that could facilitate this work and this aim is the Mizaj Research website. The Mizaj Research website has been established with the same purpose for the participations of all those interested in Mizaj studies. And here is the link of Mizaj Research. And as some my colleagues know about this website, I introduced this website for 1 minute. This website is exactly designed for Mizaj research, and in this website we have a collaboration of some people from India, as you know, Mr. Rashid Bikha from South Africa, my dear colleague Dr. Farooq Ahmed from Aligarh, and he is a special. He is methodologist, Dr. Sabiri, Dr. Ibadi. They are a specialist man in Iran, the famous specialist man in Iran that works on standard tool development and assessment. They are psychometrists. And we hope to develop or work in the Mizaj research, and we upload some webinars that we tried to discuss about the research in the Mizaj field, and we have a specific facility in this website. As you know, here is the list of Mizaj articles. By clicking here, you could download a lot of more than 200 articles specifically worked on Mizaj in the world, especially in Iran and India. And here is the list of the article that worked on the Mizaj research. And we are trying to, by the cooperation of of centers from Babel University of Iran, Tehran University in Iran, and Jamia Hamdard in Delhi, and National Yunan Institute in Bangalore, and Aligarh University, Muslim Aligarh University, and other countries in India, and some MOU. We have collaboration to have a unique method for our research and use our to each ability of each countries and each specialist to develop, inshallah, the Mizaj research projects and Mizaj research in our countries to establish the concept of Mizaj and have an evidence-based medicine, Unani and Persian medicine in the world to could help the people, the patients, the healthy people's bar or recommendation, inshallah. I am at your service and thank you for your good attention, all dear participants.
Thank you so much, sir. Now the session is open for question answer. Any participant have any question, please?
I ask all participants if there is any question, please write. I will try to answer. Hello, Mr. Dr. Khurshid, how are you?
Very fine, very fine.
In Tehran, in the north of Iran, inshallah.
Inshallah,
as soon as
inshallah.
possible.
So,
And my dear colleague, at that day, I visited them in the Delhi some years ago. Dr. Fatima, my dear colleague, Dr. Zaidi, Dr. Arif Zaidi, and other people. Dr. Shakir Jamil, Professor Shakir Jamil, and other colleagues. And I am very interested to visit you in Iran and again maybe in the inshallah India.
okay. Thank you very much, Dr. Murtaza, for your beautiful presentation. And since long we are having an association for just pondering over various aspects of the temperament and mizaj. Dear students, dear colleagues, you must be happy to know that Dr. Mujahidi is conducting a very comprehensive research in some of the institutions of Iran. So every month we have got a lecture on third to fifth, fifth of the month of every month. A lecture is delivered either by Iranian colleagues or by the friends from India. So we meticulously discuss whatever could be the possible collaborations in the studies and the development of the Unani medicine, not only in India but across the country, across the globe, particularly in Iran. And also, you will be happy to know, my dear friends, that Dr. Murtaza and his colleagues, they are very keen to have started Unani system of medicine, a graduate course of Unani medicine in Persia in the name of Unani medicine, for which we were engaged in a team to have a scheduled kind of the syllabus and exchange the syllabus in India with the exchange the syllabus from the Iran, so that we can reach to a destination. So without having any question, just it was my comment and gratefulness to Dr. Mujahidi. I remember one of the couplets from two of the poets of India regarding Unani. I can relate with the Unani theme and the temperament. One is one of the most famous poets in India, uh, Pandit Chak Bast Narayan. He said that जिंदगी क्या है, what is life, अनासिर में ज़हूर तरतीब. It is composition of the element or constitution of the element can be defined as the life, and मौत क्या है, इन्हीं अज्जा का परेशान होना. It is simply disintegration of all these elemental constitution of human body. इसी तरह से गालिब साहब, गालिब is one of the very famous and philosophical poets in India. In my personal view, he is least understood. He says, पी जिस कदर मिले शराब शबे माहताब में, इस बलगमी मिजाज को गर्मी ही रास है. So this is I can translate it for Murtaza, that he says that in this moonlight, whatever how much you drink, because my phlegmatic temperament requires the hot temperament. So thank you once again. Thank you very much.
Very nice, very nice.
Thank you.
Thank you very much.
And now this session is open for any kind of questions from our students or dear colleagues. If you have got any doubt, though I believe personally that temperament is one of the area where we need to work hard, at least to get a standardized parameter, because not on the basis of ajnase ashra in such a plural society of the India, the 10 commandments are the 10 parameters cannot be fitted to every individual. So in that situation, we really need to have collaboration, to have a standardized protocol where the quantification can be carried out, which can be helpful in determination of the temperament. This is my personal comment and this is my personal belief on that. Thank you very much.
Thank you very much for your good explanation, and inshallah, I think we could have a good team, collaborate team with its two centers, Babel University and inshallah Hamdard University, and inshallah start the agreement between two countries. Strategic research in Mizaj, inshallah, and have unique method and use the potential and the ability of our colleagues in Iran and India to collaborate our helps and inshallah arrange good research and methodological research for the future toward establish the concept of Mizaj and its relationship between Mizaj and polyclinic and disease and personality and other all things that related to human. Maybe we have in the next year, this year, maybe 2022 or more, have a MOU between two countries about the research, inshallah.
Thank you.
So, thank you, Dr. Murtaza. Hello.
Yes,
Okay,
sir.
we have
Please carry on.
Thank you. Thank you very much, Dr. Murtaza Mujahidi. I went through that you have presented a very nice way and went to through all the aspect of the Mizaj, and I am also enlightened to understand and know about that you are on website for the purpose of research on the topic of temperament, and I hope that in future you will go in a nice way to conclude the effect you see that how to take the basis of the temperament. And moreover, I want to tell you, although the Vice Chancellor of the university was also about to join the program, but due to some emergent condition, this campus at busy university, so that I speak to him so that he could not join right now. And he promised me that next time he will join, inshallah, and will have some other program. So that apology on my behalf for not presenting that presidential address by the Honorable Vice Chancellor. And he was very willing, very much willing. Yesterday I talked to him to join this program, but due to some unprecedented conditions, he is away. So that thank you very much once again, and for a nice presentation. And inshallah, we will have a MOU in between and organize such more program in future, inshallah ta'ala, and also invite you to visit our university sometime so that we may have some exchange of ideas to do something in future. Thank you. Thank you very much.
Thank you very much.
Thank you very much, sir, for accepting our request and delivering a nice lecture, enlightening us with a very useful knowledge. Now I request Dr. Nasir to present.
किसी और को कोई सवाल पूछना हो, हमारे स्टूडेंट्स जुड़े हुए हैं. If they are interested in knowing what the kind of research is being carried out in that part of the world, Iran, Islamic Republic of Iran, so they can share their ideas and views also, because Mizaj is going to take a center stage in coming future, as I guess that personalized medicine is evolving a new trend in the therapeutic management of the diseases, if I'm not wrong. Personalized medicine. Right?
Exactly, Dr. Khurshid. Exactly, yeah.
Any query किसी की? Any question from
Omar?
students? Hello. Now I request Dr. Nasir to present thank you words.
Assalamu alaikum. A very good evening to all of you. It gives me an immense pleasure to deliver a vote of thanks for this event on the behalf of our all organizing team members. First of all, I would like to sincere thanks to Almighty Allah Subhanahu wa Taala for making this event a grand success. After that, I would like to thank our Chancellor, Janab Ahmad Ahmed Sahab, and Vice Chancellor, Professor M. Absar Alam Sahab, for promoting this type of events. I would like to thank our organizing chairman and dean, Professor S.M. Zaidi Sahab, for full support and facilitating all the requirements for making this event successful. I would like to special thanks to our speaker, Dr. Murtaza Mujahidi, who honored this function with these inspirational thoughts and also well described the concept, theoretical and applied aspect of temperament. I would like to thank our all faculty members, non-teaching staff of SUMER, and online participants on Google Meet platform or YouTube channel. Once again, I thank one and all present here or join online. Thank you very much.
Computer center.
Also thankful for computer centers.
Thank you so much, sir. Once again, thank you, sir. You accept our request and deliver so nice lecture. And inshallah, in future, we will also invite you, and I think you will accept our request for further also. Thank you so much, sir.
University of